Welcome again. Welcome again, everyone. My name is Colleen Reinert, and I will be facilitating the first portion of this webinar today. This webinar will be going over unique partnerships and strategies for COVID-19 vaccines and migratory and seasonal agricultural workers. We will be highlighting results from the National Farm Worker Vaccination Assessment. This webinar today is hosted by the Farmworker Health Network. The Farmworker Health Network works collaboratively with HRSA to provide training and technical assistance to over 1,000 community and migrant health centers. These members consist of the National Center for Farm Worker Health, Health Outreach Partners, MHP Salud, National Association of Community Health Centers, Migrant Clinicians Network, and Farm Worker Justice. We have several representatives from the Farmworker Health Network on call today. The beautiful photos and names are listed. Towards the end of the webinar today, we will be going over some resources that are specifically related to ag workers and COVID-19 vaccines from each organization. But again, at any time, feel free to put in questions related to any organization in the chat box. All right, so we wanted to give a little bit of a background on how we got to implementing this assessment. So a few months ago in May, there was a high priority from HRSA to ensure that agricultural workers had access to COVID-19 vaccines and were being vaccinated. As many of our health center friends on this call know, these numbers are reported to HRSA. And the numbers of ag workers that were being reported through this data seemed extremely low to the Farmworker Health Network. And we knew that there was a bit more of a story to tell rather than a health center just putting a shot in someone's arm, that they were likely working with other local partners and organizations and utilizing different strategies to help ensure that ag workers were indeed being able to get a COVID-19 vaccines and getting vaccinated. So we proposed to conduct an assessment to better understand the landscape and healthcare access by agricultural workers and acceptance of COVID-19 vaccines within the federally funded migrant health centers. So again, that big focus was to recognize the hard work that the health centers were doing and extra efforts that they were going through to ensure there was vaccines for agricultural workers. So we conducted a very brief questionnaire, and I say that because we know how much survey exhaustion there is out there, and we appreciate getting the feedback. We know a lot of assessments come through, and we wanted to make sure that it was known that this was brief. We did have 36 responses, which represented 21% of the migrant health centers. You'll see that they are located throughout the United States. In addition to these 36 responses, most health centers did say that they would be available to have one-on-one conversations. The Farmworker Health Network met with 16 different representatives from health centers to have one-on-one conversations, recognizing that we could only get so much information from a very brief questionnaire, but wanting to acknowledge and better understand some of those strategies and unique partnerships that were happening across the nation, with the end goal to be sitting here on a call, being able to share those strategies with other health centers so that together we can ensure that agricultural workers and their families are being vaccinated. So thank you for all that participated. Thank you for all that contributed to the one-on-one conversations. And we're fortunate today to have 3 health center representatives that will be serving on the panel for this call and sharing some of their best practices. All right, so we have some basic quantitative data that I'm going to walk through. Our very first question asked, does your health center currently provide COVID-19 vaccines to agricultural workers and their families? You'll see that there was 94.6% that stated yes and 5.4% that were not providing vaccines to agricultural workers and their families. So we then asked health centers to select the strategies that they were using to promote the COVID-19 vaccine among agricultural workers and their family. And keep in mind that they were able to select all that apply. So you'll see very high rates of those who responded to the assessment, targeted outreach and education, engaging in community partnerships, participating in community-based vaccination events, working with ag employers and growers, as well as others. Some of the others that were listed included utilization of promotores de salud or community health workers, partnerships with contracted partnerships with smaller organizations, serving as a hub for H2A workers that were newly entering their state. So there were some other strategies that the health centers did document. So this slide highlights who else provides COVID-19 vaccines to agricultural workers and with which do you partner with to provide COVID-19 vaccines. So the green column are organizations that provide COVID-19 vaccines, and the orange are those organizations that health centers are partnering with to provide COVID-19 vaccines. So you'll see high rates of health systems, health department, hospitals, and other clinics providing COVID-19 vaccines. But I think more importantly, when you look at some of the smaller type organizations, the growers, the employer associations, schools, that you see really that heavy involvement of the Migrant Health Center helping to ensure that agricultural workers and their families were having access to COVID-19 vaccines. Again, we know that these take extra steps and efforts to get there. We also recognize that it's the only way that we can ensure that we're reaching this special population. And then the last, I think one of the most interesting ones is we asked a question, is there a process in your community to share the number of COVID-19 vaccines given to agricultural workers and their families? Surprisingly, 54% of our respondents said that there was a process in their community, and 46% stated that they did not have a process. But by having this process of understanding what agricultural workers have been vaccinated really provides tools to the health centers to help them conduct that targeted outreach and set up special vaccine clinics and work with farmers. So I think that this is a really key piece of information in ensuring that ag workers do have access to COVID-19 vaccines, and hopefully, we'll be able to share some of those experiences with the panelists today. And it may be a way for those that do not have this currently set up in their community or area of designation to start to work with others to be able to determine what ag workers have been vaccinated. So with all of that data, I'm going to go ahead and pass it over to Gladys, who is going to welcome our three panelists, and we'll follow up after the panelist discussion with a live Q&A period. Thank you.
Thanks, Colleen. Hi, everyone. As mentioned, my name is Gladys Carrillo. I'm with the National Center for Farmworker Health, and I have the pleasure of welcoming our health center panelists this afternoon. So one thing that we did as part of this assessment is really follow up with individuals who wanted to share a little bit more information about some of the information they had shared within the assessment. And we received responses from the three ladies today that I think were very, very helpful for us to get a better picture of what's happening on the ground. So we wanted to extend an invitation for them to share some of the strategies with our audience this afternoon. So I'll have each of them go by and introduce themselves before we jump into the actual questions that they will be sharing strategies about. So Herminia, do you want to kick us off?
Sure. Thank you so much, Gladys. Happy to be here, and hello to everyone. My name is Herminia Ramirez. I am a program manager for Vista Community Clinic. Our clinic is an FQHC and Migrant Health Center located in San Diego, in North County, San Diego, to be specifically, if anyone's familiar with that region. We do a lot of work around our supporting our farm worker families, and some of the efforts that we have been partaking in, you'll get to hear about today. But our agency has historically had a long commitment to serving our farm worker communities, both in our clinics, in the community, and employing the promotora model, which is kind of my focus in the work that we do. And we're excited to share what our COVID response looked like, and all that good stuff with you. So thank you for having me today.
Thank you, Herminia. Natsali, do you want to go next?
Yeah, buenas everybody. My name is Natsali Pacheco Rojas. I'm the practice manager here at Family Health Clinica. We are based in Watoma, Wisconsin. So it's like right in the middle of Wisconsin, if you know where that, try to look at it in the map. We are a federally qualified health center, as well as Wisconsin only migrant health center. We have served the migrant workers well from the beginning of when FHLC started, and it has continued to be a core service and mission and value that we continue to do. Similarly, I'm excited to be able to share how our experiences working with the farm workers for such a long time transitioned during COVID, and how partnerships were created during this time as well.
Thank you. And last but not least, Julie.
Good afternoon. This is Julie Pedretti. I am with Healthcare Network. We're located in Immokalee, Florida. We are in Southwest Florida, a very large county, Collier County, about the size of the state of Delaware. While we serve the entire county, we've got 17 practices. Our COVID response team, which was created a year ago, now about 15 people, primarily serves the Immokalee farm worker community. We have migrant farm workers primarily farm workers in the 27,000 people who live in Immokalee. We at one time were the largest producers of tomatoes. Our farm workers are Spanish speaking and Haitian Creole, as are our community health workers. I'll talk a little bit more about our partnerships, which have been developed and expanded as a result of COVID. So the one thing that has come out of this pandemic is just a closer relationship with the community and our outreach work, which includes a mobile unit and going door to door with the farm worker community. Glad to be here. Thank you.
Great. Thank you, ladies. So I know that you are all very eager to share your experiences, and we're very excited to hear about them. So let's kick off with our first question. You know, you all have seen the impact on the ground, especially as you continue to serve vulnerable populations, particularly agricultural workers that we're talking about today. But can you share some of the specific strategies that you had to implement as part of your service delivery to really reach this vulnerable population as you started to implement and offer the vaccine to your patients?
Sure, I can kick us off if that's okay. So for Vista Community Clinic, we're, like I mentioned, we're located in San Diego, and we have a very unique landscape. We're within the border region, and we also teeter-totter between really rural areas, but also some suburban and urban areas. So it's a really unique landscape. And I'll talk about 4 things really briefly that really centered our approach at the clinic in terms of how we responded specifically and how we provided resources to reach our farm worker communities. Number 1, consistency. Number 2, accessibility. number 4, intentionality, and and 4, responsiveness. And those 3 factors really, as kind of larger strategies, really drove our work. I would say with consistency, our work, and I'm sure my colleagues here will also attest, is that our work started long before the pandemic, especially in farm worker communities. We have been doing a lot of work, and so we sort of used all of the resources, partnerships, and efforts that we had to really leverage on that. And during COVID, one of the most interesting things that happened, and of course you all saw this, is doors closed to businesses, to locations, to different sites. And our work was really to open up those things up. And we did so by ensuring that we were consistent in where we were in the community, the partners we were connecting with, and really working towards always providing consistent accessibility. Related to COVID, I would say one of the biggest things that our team did was provide education. So often we were at sites before we were actually doing the service delivery of providing vaccines or even testing out in the field. And that's partly because we, like I shared earlier, a lot of the work that we've done, relates really to the trust that we've built over time, both with the farm worker communities, but also the partners, so that they could grant us access to be back on their sites providing these services. And with responsiveness, I think that's both in terms of responsiveness to the pandemic, but also to the community, right? During the pandemic, we had lesser connection with the community than we typically do, and really maximizing points of contact with the community to identify needs and be able to respond to that and bring resources and really be accountable to the community. And I think with accessibility, and I apologize, I'm jumping back and forth as they're coming to mind, really going to the community. So one of the tools that we got access on early into the pandemic was a mobile unit, which of course was flagged as a key resource to be able to do service delivery at agricultural fields.
Great, thank you, Armenia.
I would echo all of the things that were just shared. Building trust in the community, and our community health worker team is relatively new, and going door to door was very important with a team of people who spoke the language and understood the community alongside the local partners. So the Coalition of Immokalee Workers, Mission Piñel, local organizations, we aligned with them, and they helped open doors for us and helped build trust around COVID education to start with, then testing, and then vaccinations. It was just critical to have people feel comfortable with us when we started to do testing events, and we also went right into the communities. We went into the neighborhoods with the mobile unit. We did testing and vaccination events in the evenings. We did them on weekends. We did them near churches, wherever people gathered. So we tried to make it as absolutely convenient as possible. The other things we focused on were trying to break down all of the barriers around technology and transportation. Some of the testing events and some of the vaccine events early on were in places that were not accessible to our population. So we worked very hard to bring those events locally, and in fact started doing our own testing events out of the mobile unit, and helping to personally make phone calls to farm workers in our community to schedule them to get vaccinated when they were unable to get onto computers and make the phone calls and wait around while they had jobs in the field. So understanding what the barriers were, and then working with those barriers to make sure that they had as easy access to the testing and vaccines as anyone else.
That's great, Julie.
Yeah, they took all of my points. No, similarly, very, very similar to all of what you guys have mentioned already. We definitely worked hard on building community trust. We actually, a huge portion of what we had done with AFHLC was advocacy through the state, and we were actually able to coordinate with the state to be able to provide and get resources to vaccinate the migrant farm workers. That actually meant for years we have had actually mobile services. We have a pretty awesome state-of-the-art mobile clinic, and we were able to utilize that, but also send out smaller vaccinator locations with like 15 passenger vans, where we were able to target smaller groups of farm workers, trying to really take away that transportation barrier, as well as hire bilingual workers. That was a key strategy on our side, acknowledging that if you spoke the language, that automatically brought comfort in a sense of, okay, I'll be able to open up and hear what your health education has to say. Something that we did strategically for the vaccine as well was actually build or have a community outreach coordinator. That is something that we had not done beforehand, and they really was able to coordinate from farm worker to us. Usually we work very close and tight with the employers, and this was able to really get the feedback from the farm workers themselves. And we have seen that show good response from the community.
That's great. It really sounds like all of your sites really have established processes in place, and were quickly able to adapt some of these areas so that you could really reach the population, especially during this critical time of the pandemic. Some of you have mentioned partnerships in your responses, and that really leads me to the next question. We really wanted to know, how did you establish any new partnerships that helped support your vaccination efforts? Or if you already had established partnerships, did any of those evolve or change in order to, like you mentioned, be responsive to the community needs during this time? And Netzali, why don't you kick us off so you can address a little bit of the partnerships that you had established?
Yes, so in Wisconsin, we actually have a migrant law where the Division of Department of Workforce Development works hard to make sure that our migrant workers are safe and sound in a lot of these areas. We were able to collaborate with Wisconsin in that sense through a lot of advocacy, as well as Wisconsin Farm Worker Coalition. This is a partnership that was already built before the pandemic, but definitely was utilized as soon as the pandemic hit. We were not only able to provide information across multi-sector organization from state, educational, legal, as well as employers themselves were part of that organization to provide the information on time as everything was changing so rapidly. Part of that was also being able to strengthen our employers' relationships. We have been able to provide primary care to quite a handful of the locations that we had been going to, and we utilize those connections to continue our COVID services and also promote the vaccine. A portion of that was actually before migrant workers migrated to the state of Wisconsin. We were able to target some of the recruiters and give them information about the vaccines, what to expect when people were coming, resources on how they could contact. And I'm going to jump back on the previous one. One key factor on being able to be part of the Wisconsin Farm Worker Coalition is that we had multiple ears and eyes. If one organization was able to touch base with another farm worker or another employer, and they realized that they were wanting the vaccine, they would be able to refer them to us, and we would be able to have that connection. That was pivotal, and that was really great, strengthening our relationship and being able to provide the full service of vaccinating the farm worker.
That's great.
Yeah. Mm-hmm.
Did you have something else to add?
No, that's good.
Okay. What about Julie or Armenia? Anything else that you wanted to speak on in terms of the partnerships that you had established or that maybe evolved? Because as Natsali mentioned, one of the biggest things with the pandemic is the ever-changing information, right? Keeping up with the current latest data, the latest that you have to share with your patients. And so I would imagine partnerships are a critical part of disseminating some of that information.
Absolutely, and I'll highlight just one of the most recent partnerships that we're very excited about, and that related to the Pfizer vaccine being available to 12 and up. And our clinics were providing Moderna and J&J, but we were not capable at the time of doing the Pfizer vaccine. So we had our local children's hospital, Galazano Children's Hospital, providing in our clinics and then eventually in some patient and community outreach clinics, the Pfizer vaccine, so we could start getting children of farm workers vaccinated. Eventually, we worked with Galazano Children's to set up mobile vaccination events, again, in the neighborhoods, and started setting up what we called combo events. So we would do a testing event. At the same time, we would do a vaccination event, and the crosswork was wonderful. The other thing that helped Galazano Children's is they often didn't have someone who spoke Spanish or Haitian Creole and didn't understand how to help people fill out all the crazy forms and didn't have the literacy levels that they needed. So we also had our staff, our team members, helping them with the vaccination piece. So they are thrilled with the partnership as we are, and it's continuing to expand, and we're continuing to do vaccines for 12 and up in throughout Immokalee.
That's great, especially as the vaccine becomes available to younger and younger patient populations. I think being able to inform our communities is going to be critical, especially right now within the school systems. Armenia, anything else that you wanted to add about the partnerships?
Yeah, and I mean, Julie and Natsali covered it really nicely. And for us, what I'll share is Vista Community Clinic has been the backbone organization for Farmworker Care Coalition, which is a coalition that has been around for a few decades and really brings multi-sector partners to work together, talk to each other, which is in times of a pandemic is crucial, and really work to support our farmworker communities here in San Diego. We, of course, always welcome new partners. And for us, the partnerships were really key, and they were already established. So that was one thing. But what we did was use the Farmworker Care Coalition platform to really work together and organize our efforts and really see which gaps could be filled. So for example, if one team had a stronger outreach services and another team could coordinate vaccines faster, I think we just all really sought to work together to fill in where we needed each other and really work as a coalition for a stronger response. And of course, with the vaccine, the biggest resource is who has access to the vaccine or who did early on, right? Because we know that now there's access is more readily available. So we really work together with meeting the needs of employers. As an organization, we have capacity limitations in terms of how many farm workers were able to vaccinate at one site, but some of our partners did it. They could vaccinate unlimited number of farm workers. And so the goal was also to not step on each other's toes, to have the appropriate partner respond, and really to leverage resources and get vaccines, health education, all of the needed resources out as fast as we could, partly because of what you noted earlier, Gladys, is that things are changing, questions keep growing, right? And now we have the booster to contend with. So making sure that as we are getting the information as agencies, so is our community getting that information in that same time frame.
Thank you. That's great that you were able to really work together. I think that is a big part of the success in being able to reach these communities, having multiple players in place already and building on those relationships so that you can really reach the population. Another question that we had that we're very interested in, and I think a few of you already mentioned some of the barriers that this communities face, but was there any particular barriers that were significant? How did you overcome them? What are some ways that you would suggest other health centers overcome some of these barriers if they're encountering maybe similar challenges like transportation, like language, that a couple of you have already mentioned? So can you speak a little bit on that? Maybe the biggest barriers in really providing COVID-related information to this vulnerable community and ways that you overcame those barriers. And I'll have Julie kick us off at this one.
I think one of the challenges we faced in Immokalee as farm workers were starting to head north up to Wautoma, Wisconsin, getting them vaccinated before they left and reaching out to the growers to get their cooperation to schedule an event, and we did, on a Saturday where they literally bussed farm workers in to be vaccinated. We did some 450 vaccinations that day, J&J. But it would have been great to have been able to do that earlier and more often, and with more of the farm work, more of the growers involved. Connecting with growers is not easy. And even those who said that they would show up with a busload, the harvesting was going really well on that Saturday, and the weather was beautiful, and they needed the farm workers in the field. So we did not get them all. So that's an area I think we're anxious to just get more closely aligned with farm worker, the growers, and figure out ways that we can help them get their farm workers vaccinated.
Thank you, Julie. I think you're right. Being able to have a win-win relationship, right, and figure out ways that it's works for both you, that partner as the employer, and you as the provider. I think that is a key element to making the partnership a success. Any other particular barriers, Herminia or Natsali, that you can think of that were significant, and ways that you overcame those to really reach our agricultural worker population?
Sure, I can go first, Natalie, if that's okay. One of the barriers that we see, and we actually still have, is that lapse in communication and getting resources out there. And of course, Julie just mentioned, it's very rare where you get a 100% vaccination rate at different sites. And what this posed for us as an organization is a challenge to make sure that we came back to those sites. And I think I saw this question in the chat earlier, is how often are we going to work sites? And for us, if the site didn't have 100% vaccination rate, we were returning monthly if they allowed us, more often if the site gave us access, because a lot of the questions that were coming from the community were very tangible questions that if we provided a response through a trusted messenger model, which was key for us, using our promotores and our community health workers to get that information out, they were more likely to then engage and seek services. And then of course, making sure that we were closing the loop, that we were making, if we identified folks who hadn't gotten the vaccine when we were there, we were connecting those farm workers to resources that were accessible to them, that were in the community. And one thing that might be a unique challenge to our region, and San Diego has had for a long time an ever-changing landscape in terms of housing for farm workers and where the farm workers are located. Here in San Diego, there's less access to housing, and so our farm workers are embedded into our communities, into often sharing apartment complexes or single residence homes. So a challenge for our organization in reaching farm worker communities was to make sure that our outreach was comprehensive and cast a wider web than what we would normally go to, which would be the work sites. We knew that we needed to catch folks at our local swap meets, the local supermarkets, and really make sure that we had various access points to our community. And oftentimes, and of course I say this because it's a personal anecdote, I come from a farm worker family myself, and I know my mom is the head of the household, and my dad he did get the vaccine because she told him to. And that's a similar structure to what we see. Cultural dynamics, being an agency that responded with cultural humility, understanding these factors that play a role, and really being responsive to the community needs in all kinds of ways. And of course, outreach becomes more challenging when you have to cast such a wider web, but getting more resources was crucial to our organization. Funding that was made available to us because of the assistance that came through the federal government was also crucial to deploy more outreach services. And then going back to a point I made earlier in terms of consistency and I think Julie also shared, is that people knew where we were going to be, even outside of their work sites, knew that we were, when we use a local park currently to still offer vaccine access on a weekly basis, knew that we were there and nestled into the same communities that often leave to fields for work, but then come back to where they live. And really kind of thinking about a larger picture in terms of what our community environment looks like and where we can plug in resources at every section, and really being exposed and connected to the community.
Thank you, Armenia. You're right. Effective messaging is critical, and that helps when you really know your population.
Yeah, so from Family Health Clinica's view, to add a little bit about that, is we receive migrant workers once they've, a lot of the vaccinations had already begun to be deployed. Something that we foresaw of a challenge was having people come in with only one dose, especially the older population, and seeing how we were gonna be able to keep that record. Later on, we were able to either coordinate with our partners with public health to give them their second dose, or just transition them into the Johnson & Johnson vaccine. But that was something that we definitely saw a bit of a challenge. And then also with the education on non-American vaccinations or non-FDA approved, that was something that we had to also change and be like, we need more information on this to be able to give to the workers. With that, another thing that we saw a bit of a challenge was transportation. I think was key. We again, we were able to provide all over 72 counties, but it doesn't make a lot of sense sending a whole team for 5 people. So that's something that we had to coordinate a lot more with our partners up in the north, or partners down in the south, to be able to have each other's back in that sense. And then similarly to Armenia, we transitioned from the previous year when we were doing a lot of testing to acknowledging that we wanted to touch base with the actual farm workers. And that included going to where they were, not necessarily maybe with the employer, but actually setting stations with our community outreach workers at Mexican stores, or laundry places, and that has helped and has seen an improve on being able, people feeling comfortable to ask questions and changing their minds, be like, okay, I'll get the vaccine.
Thank you, ladies. And it looks like we do have a question related to vaccinations and really having that messaging to the communities. Do you have any suggestions for providing booster vaccines to farm workers before they return to their home country after the growing season?
I can touch on this briefly. We actually were working with our partners on this topic specifically yesterday, so it's fresh on my mind. And one of the things that is true and has been true for the entire pandemic is that it's not so much of can we deploy our boosters right away, because I think we all want to, but currently our FQHC, for example, has given us guidelines in terms of who's eligible right now. So we also have to work within constraints of how boosters are being rolled out. And, you know, similar to what the constraints at the beginning of the pandemic, that there were population specific tiers, at least in San Diego County. That's how the deployment of the vaccines first started. And for us right now, target populations are those 65 years or older and those with chronic diseases. And of course, it gets more nuanced than that, right? It's now age, it's other qualifying factors, but it's also really that individualized information, because we know that as a best practice, the one shot vaccine Janssen was one of the most beneficial to this population because of the migratory nature, but that is one population that doesn't qualify for a booster yet because that vaccine hasn't been approved, and same for Moderna. So it's really being up to date in terms of how boosters are being rolled out and really keeping in tune to that, so that we can then appropriately get out resources to the community. And of course, we know that within our farm worker population, we have a lot of folks who are going to meet that criteria, but we have to be so intentional to roll out that information, because we don't want to create more confusion and add to the already multi-layered approach and kind of really be an agent that deciphers the information for our community instead of creating more confusion in the partnerships that we're working with and communities we're serving.
Yeah. And that was so well stated and really highlighted one of the biggest challenges of the entire pandemic is the fact that every state did different things in different ways, whether it was testing or vaccinations, and then every local community kind of had their own different rollouts. So every area across the United States was doing things a little bit differently. It had to be customized, and you had to really stay on top of the information, which is exactly what we're doing right now with the boosters.
Anything else to add, Natsali, to that?
No, I think that was well said.
All right, ladies, well, we'll finish with this final question. And really, it's to celebrate you and your successes of your program. So if you can share one highlight, the thing you're most proud of in terms of the efforts that your sites have done so far in reaching farm worker communities, and particularly with the COVID vaccine, what would it be?
I guess we're really proud of having a trusted team out in the community that now reflects so positively on Healthcare Network as a primary care provider, and helping people understand the importance of primary care and handling all of the underlying health conditions. So the whole vaccination process has also been an education around people and health, local health population health.
Thank you, Julie. What about Herminia or Natsali, your biggest success, thing that you're most proud of in terms of your efforts?
I can go next, Natsali, if that's okay. I feel like I'm always very vocal, so I'm mindful about that. But I think one of their biggest successes as an agency is in our work in migrant health for Vista Community Clinics is housed out of our health promotion center. And we, in March, and I think a lot of us remember the day we were sent home or whatnot, and our migrant health team and outreach team were sent to work from home for 2 weeks. And we really used those 2 weeks to strategize and regroup and operationalize all of the changes that we needed to make sure that we were serving our community in safe ways, but making the biggest priority to stay out in the field the entire time. And so I think that's a proud point. And the other thing is also recognizing, I think our team did a really good job to recognize that vaccines and testing, all of those things are important, but that our farm worker communities suffer from other pandemic related effects. They lost wages, they lost housing even. We're still seeing the effects, and really working with partners and funders to make sure that they were aware of all of these other pandemic related effects. And one of the things that we were able to do is set up a financial assistance program, because especially in San Diego, housing is a crisis, and we're not going to pay their, what they need is money to pay their rent, and really recognizing what really is they need. Yes, we delivered vaccines, we delivered tests, we did all of that, but we also hosted food distributions, delivered food to work sites. We also did that financial assistance program, and really addressing COVID in a comprehensive way because of the effects that we're going to see in the farm worker community for some time to come, which are related to all the things that I just shared.
Thank you, Herminia. That's so very true.
Okay, yeah, so it worked out well in Media. I'm an internal processor, so that was really nice. For Family Health Clinic, I think I would say that I'm extremely proud for the motivation and the effort that the whole entire team, from the ones that were working boots on the ground to the ones that were making decisions, and our board of directors as well, to continuously put advocacy and efforts to provide to the farm workers a huge, it took a lot from the beginning of it, to learning how to speed up our processes and how to continuously be changing our workflows, and the flexibility that we continuously showed from the beginning of the pandemic even till today. Was able to really highlight, I think, and continuously keep in mind the quality of care, and acknowledge that farm workers and everything that they come with, similarly to with Armenia, we were able to not only work for the medical side, but also be able to acknowledge and see if there's any recommendations or referral that we wanted to touch base on with other organizations. So always remembering the farm workers as wholes. Mm-hmm.
Thank you, ladies. And that concludes our Q&A. I think we addressed all the questions that were also in the chat. We really appreciate you coming onto today's webinar to share these great strategies, and really applaud your sites and the staff, the efforts that have gone through really keeping this community at the forefront, because I think all of you really highlighted that this population has other challenges aside from the pandemic that really need to be continued to address within the community, which is, I think, a big part of why all of us here at the Farmworker Health Network truly advocate for ag worker access, and the campaign is a big part of our efforts to reach this vulnerable population too. So thank you, ladies, for joining us this afternoon. And with that, we're going to transition now to some COVID-related resources that we're hoping could be of help to other health centers. Hopefully you gathered some strategies from our speakers today, but our farm worker health representatives will now be sharing some particular resources that could be of use too.
Thank you so much, Gladys, and thank you again to Julie, Edminia, and Sally for all that you shared today. It's always wonderful to be able to highlight all the great work that's happening at the health centers, and we really appreciate, as Gladys said, all the work that you're doing to vaccinate farm workers and to connect them to healthcare. Farm worker justice, we have multiple COVID-19 resources like all of our colleagues. And so we're each organization will share the resources, starting with farm worker justice. So we have resources for workers and farm worker serving organizations, issue briefs, brochures, PSAs. Many of our materials for workers are in multiple languages, including Spanish, Haitian Creole, with some resources in Mixteco and other indigenous languages. And then also on our website, we have information just generally about policy recommendations and state and federal information. So we highly encourage you to go to our website, and we'll share this PowerPoint so you'll be able to access all of these links that we are sharing right now. And with that, I will turn it over to the next FHN colleague.
Great, that's me. Hi, everyone. So HOP provides TTA, particularly on outreach. So as you can see here, we have a plethora of resources on outreach, particularly on reaching ag workers and their families. So these are some of our resources, among others, on our website, so you can find. I do want to highlight just a few. I know we're running a little bit over time. So we have our structural competency webinars that focus on frameworks and key concepts like structural violence and racism, and to give you a better understanding of what happened during COVID-19 and what certain communities and how they are extra vulnerable. We also have our self-care resource here to help support staff who have been burned out from the pandemic. So if you are doing this outreach work and feel like this may be a resource to support you, check it out. And we also have our transportation resources, just, to name a few. This one in particular is one that we're focusing on how it was impacted during COVID-19. You can also find many other fact sheets, reports, and more information on health equity and what that means for health outreach partners in our work with ag workers. So check us out. Next slide.
Theresa, you are on mute. Hopefully you can hear me.
I double muted myself. Thank you all. I am Theresa Lyons-Clampett, a Senior Program Manager for the Migrant Clinicians Network. And we are a national 501(c)(3) organization that provides support and technical assistance and professional development to clinicians in community and migrant health centers across the country. I'm going to highlight just a couple of resource links today that are particular to COVID-19. We are including a witness-to-witness program of Dr. Kata Weingarten in our resources today. Dr. Weingarten designed these strategies to offer fostering resilience within your organization. And you can also find a number of additional COVID-19 specific resources at the other link on Migrant Clinicians Network, where we do have some low literacy and multilingual resources, and COVID-19 resources specifically for pregnant people, respirators, masks, and the like. And we're continually updating these resources, as are all of our colleagues for the Farmworker Health Network. So I'm glad to share these with you today, and hope that you find them useful. Thank you.
Hi, everyone. I'm Colleen from MHP Salud. I just have one main link to check out. If you have promotores or community health workers, please feel free to direct them to our COVID-19 directory for community health workers. This includes some of our own developed resources that are specific for agricultural workers, but also tools for community health workers that have been developed by other partners as well. So please feel free to check it out. Thank you.
Thanks, everyone. And to wrap us up, I just want to highlight a few resources from the National Center for Farmworker Health. We also have a lot of information available on our website. We have infographics, flyers, fact sheets, checklist, songs, video and audio PSAs, and we have resources available in English, Spanish, Indigenous languages, and Haitian Creole. So we definitely encourage you to check out our website and download any of these resources for your outreach efforts or any information that you share with the farm worker community. Next slide. And with that, we encourage you to please provide input on today's webinar. All of you should be receiving a prompt as you exit today. If not, you can definitely use the QR code here. Use it with your phone to screen it and it'll pop up on your phone so you can fill out that evaluation. We welcome your feedback, are always looking for your input on ways to improve our webinars and training, so please provide that input to us. Next slide. And with that, we conclude today's presentation. We thank you everyone on behalf of the Farmworker Health Network for joining us today, in particular to our 3 great speakers for their great information and for the strategies that you were able to share with our audience. We look forward to seeing you at our next presentation.